Imagine a common, yet often unspoken, challenge that affects millions of men worldwide. It impacts confidence, relationships, and even the journey to parenthood. We're talking about erectile dysfunction and premature ejaculation. These conditions are far more prevalent than many realize, and they are not just physical issues. They carry significant emotional and psychological weight, often leading to feelings of isolation or inadequacy. Our goal today is to demystify these topics and explore natural, empowering solutions. Erectile dysfunction, or ED, is simply the consistent inability to achieve or maintain an erection firm enough satisfactory sexual intercourse. It's not just an occasional occurrence, but a recurring pattern that causes distress. This condition can stem from various underlying factors. Understanding these causes is the first step towards effective management and recovery. It's a complex interplay of physical and psychological elements. Physical causes often include cardiovascular disease, diabetes, obesity, and neurological disorders. Lifestyle choices like smoking, excessive alcohol consumption, and lack of exercise also contribute significantly. Psychological factors are equally important, encompassing stress, anxiety, depression, and relationship problems. Performance anxiety, in particular, can create a self-perpetuating cycle of difficulty. Premature ejaculation, or PE, is characterized by ejaculation occurring sooner than desired, often with minimal sexual stimulation. This happens before or shortly after penetration, causing distress for the individual or couple. Like erectile dysfunction, premature ejaculations are common male sexual dysfunction. It can significantly impact sexual satisfaction and intimacy, leading to frustration and avoidance of sexual activity. The causes of premature ejaculations can be multifaceted. Psychological factors frequently play a role, including anxiety, stress, depression, and early sexual experiences. Relationship issues can also contribute. Biological factors may also be involved, such as abnormal hormone levels, inflammation or infection of the prostate or urethra, and inherited traits. Sometimes, it's a combination of both physical and psychological elements. Now, let's address a crucial question: how do these conditions affect fertility? The connection might not be immediately obvious, but it is significant. Both erectile dysfunction and premature ejaculation directly impede a couple's ability to conceive naturally. If a man cannot achieve or maintain an erection, or if ejaculation occurs too quickly, the chances of sperm reaching the egg are drastically reduced. This can be a source of immense stress for couples trying to start a family. The good news is that many individuals find success with natural approaches. These methods focus on holistic well-being, addressing the root causes rather than just the symptoms. They empower you to take control of your health. These natural strategies are often complementary to medical treatments. They can improve overall health, enhance sexual function, and boost fertility potential. It's about nurturing your body and mind. A cornerstone of natural improvement is adopting a healthy lifestyle. This includes a balanced diet rich in fruits, vegetables, lean proteins, and whole grains. Limiting processed foods, unhealthy fats, and excessive sugar is crucial. Regular physical activity is another vital component. Exercise improves cardiovascular health, reduces stress, and can boost testosterone levels, all of which are beneficial for sexual function. Aim for at least 30 minutes of moderate exercise most days. Managing stress effectively is paramount. Chronic stress can wreak havoc on hormones and nervous system function, directly impacting sexual performance. Techniques like meditation, yoga, deep breathing, and mindfulness can be incredibly helpful. Prioritizing adequate sleep is also essential. Sleep deprivation can disrupt hormone balance and increase stress levels, negatively affecting both ED and PE. Aim for 7 to 9 hours of quality sleep per night. Certain nutritional supplements and herbs are often explored, though always consult a healthcare professional before starting any new regimen. Some examples include L-arginine, ginseng, and yohimbe, which are believed to support blood flow and sexual health. However, it's crucial to remember that individual responses vary. What works for one person may not work for another. A personalized approach, guided by professional advice, is always recommended. The psychological aspect of erectile dysfunction and premature ejaculation cannot be overstated. Addressing underlying anxiety, depression, or relationship issues is fundamental. Therapy, such as cognitive behavioral therapy, can provide valuable tools and strategies. Open and honest communication with your partner is also incredibly important. Sharing your feelings and concerns can reduce performance anxiety and strengthen your bond. Mutual understanding and support are key. Remember, you are not alone in facing these challenges. Many resources are available, from support groups to specialized therapists. Seeking help is a sign of strength, not weakness. While natural methods offer significant benefits, they are not a substitute for professional medical advice. If you are experiencing persistent symptoms, it is crucial to consult a doctor. They can rule out serious underlying conditions and guide you toward the most appropriate treatment plan. Taking a proactive approach to your health, embracing natural strategies, and seeking professional guidance when needed can lead to significant improvements. You can regain confidence, enhance intimacy, and move closer to your family goals. Thank you for watching. Don't forget like, share, comments and subscribe and press bell icon for more health and fitness tips, information of reproductive health. See you again in next video.